Hi, I'm Dr. John Young, medical doctor,
Hi, I'm Alex. I'm a nurse practitioner.
and we work together here at Foundational Health Center in St. Petersburg, Florida. And we're doing a series on hormones, male and female hormones. And today we're going to be talking about progesterone. Alex, everyone knows about estrogen. What about this progesterone?
Progesterone. So women make tons of progesterone, and we can only make progesterone after ovulation. So we all know that we have to ovulate in order to get pregnant. So after we ovulate, that's when we make progesterone. Now, used to be the case that in the past, women would have a hysterectomy and they would go to the gynecologist and say, I have night sweats. I feel like I have joint pain. I'm so stiff. I can't sleep. Do I need some progesterone? No, you don't need progesterone because you had a hysterectomy. You don't have uterus anymore, so you don't need progesterone. So it used to be that we believed that progesterone was only important for the uterus, just for that organ. We know now that progesterone plays a lot more. It's more important than we used to think it is. So we have receptors for progesterone in the brain. So it's important for relaxation and for sleep for women. It's important to balance your estrogen. So if you are estrogen dominant, you want to know if you are making progesterone and if it is enough in relationship to your estrogen. So if there's a history in your family of breast cancer or ovarian cancer, you probably want to look at your progesterone level to see if you have enough to balance your estrogen levels.
So it's a ratio.
It's a ratio. Okay. Now, progesterone is very, very important, not only to balance your estrogen, but also it's important because progesterone causes apoptosis, which means progesterone sends the signal for the cancer cells to die. When things go wrong, progesterone sends out the signal and it says it's time to go. So you have less of a chance of developing cancer. That's what we know today. That's what the latest research shows. Now, it's also important for joints. A lot of women, postmenopausal women, have a tendency to say to me, I'm very stiff. I exercise, but I feel like I have a lot of joint pain. So that's the low progesterone. So we need to look into that. Now, progesterone is the good way to remember is when women are pregnant, just the word pregnancy of progesterone, right?
Yes.
So when women are pregnant, they have a lot of progesterone. So they have to have that so they can relax their joints, so they can have a natural birth. So progesterone is important for your joints. It's essential for that. So we look into the progesterone very carefully at all ages. Okay.
All right. So now, can you take progesterone also? You take it as a cream, or can you take that orally?
Good question. Progesterone is the only hormone that we can do orally, and we can do as a topical cream. Also, we can do as a sublingual progesterone, because the metabolites, if you swallow a pill as a progesterone pill, the metabolites of progesterone are actually good for you up to a certain dose. But it's good for you. So we actually benefit from taking oral progesterone. Now, we're talking about bioidentical progesterone. I'm not talking about prescription prescription progesterone. Okay? Because that's the medroxy. Anytime you see a hormone attached to a chemical name, that's not bioidentical. That is pharmaceutical grade hormone.
And we try to stay away from those.
We stay away from those. Yes.
All right. So, how do you tell what the right dose is? What happens if they take too much progesterone or too much estrogen, or what happens?
That's a very good question. So there's a few ways we can do this. One of the ways that we use is based on sleep, because every one of us women, we're going to have different requirements for progesterone levels. So some women will need more, some women will need less, depending on the receptor cells. How many do they have? So sleep is a good way to guide that. So we can improve and increase the dose of progesterone up to the point where they're sleeping better now. Okay, so that's one way we do it.
All right. Now, is progesterone important for guys?
Progesterone is also important for guys because you need progesterone to regulate your estrogen and your testosterone. So for guys, it's the same thing. We still have to test testosterone, estrogen, and progesterone. Because anytime those hormones go, now for men, your progesterone levels are very little, so you don't want to have a lot of that, but you still have to have it. You still have to look at it. You still have to test that.
All right. The one thing that I've learned, and there's certain things you like to treat, and one is or sleep problems in women. Guys are tough, but the nice thing that I've learned with women is this: that if they have trouble sleeping, first of all, progesterone does not put you to sleep.
Right.
But once you are asleep, they tell me, John, after about an hour, I wake up, I'm up for an hour, I go back to sleep, I sleep for an hour and I wake up again. And that is a progesterone problem.
Yes.
And one of the things that Alex and I both agree with is the smaller the dose, the better.
Yes.
And so I will put them on 25 milligrams of progesterone. Some people put them on 100, 200. But if you don't need that much, it's just excess drugs.
And that's a very interesting point you just made there, because we have a natural progesterone approved by the FDA that comes in 100 and 200 milligrams. So see, that's a problem, because what if you take 100 milligrams and you don't need 100 milligrams? So that we don't do that. We give the lowest dose that we can possibly do to relieve your symptoms.
And that's 25, and we tell them, take it tonight. Didn't do anything, young. It was a waste of time. 50, 75, 100, you can go up to 300 milligrams.
Yes.
And patients will tell us, John, at 175, I sleep like a baby.
Yes.
And then we can get a 175 milligram pill made for them.
Yes.
But I wish it worked that way for men. It doesn't.
It just doesn't, because it's more like the testosterone. One thing important about progesterone that I want to make sure I make my point across is that women, from the period that you get your first menstrual bleeding, that's very important to know your insulin levels then, because you can have a low progesterone age of 12, 13, 14, and you're going to have anxiety and you don't know why, and you can be 25 and you still have anxiety. It's because you have low progesterone, and at that age usually means they have high insulin. If you test the levels of insulin hormones in those the younger population, you're going to find high insulin, low progesterone.
And what I think is interesting is, as we're dealing with other doctors all the time in the area, and really they are not. A person comes in with anxiety and they've seen other doctors. Oh, so they put me on Prozac or Zoloft or something like that, and they never looked at progesterone. Never looked at it.
They never look at it. And for the human brain, for especially women, we need that relaxation in the brain. That's why we make progesterone for us.
So I hope this has been helpful. I learned something today, and we're learning from our patients all the time. But it's something that you really need to look at and make sure that your doctor really does look at all of those hormones, because they're there for a reason. So until next time, thank you for listening to us.
Thank you.